Assalamu alaikum, this is Shama, and today our topic of discussion is how we can easily differentiate between an exudate pleural effusion and a transudate pleural effusion. So before it, I'll explain you briefly what is exudate pleural effusion and what is transudate pleural effusion. Exudate pleural effusion is basically in which there is any inflammation within the pleural cavity, and that inflammation will lead to increase in the permeability of the capillaries, and fluids and stuff from within the capillaries will start to leak outside into the pleural cavity, causing pleural effusion. So by this thing you can easily recall that protein will be loose from to the vessels, from the capillaries and other material. So this is exudate, and its causative factors are bacterial pneumonia, TB, malignancies, or some connective tissue disorders. While what is transudate? Now transudate is an occur because of an imbalance between capillaries pressures, hydrostatic pressure and oncotic pressure, that lead to fluid loss from the capillaries. And it is now, since it's a difference of pressures, so we can recall that it will occur all over the body. Factors like because of heart failure, or because of hypoproteinemia, nephrotic syndrome, and some constrictive pericarditis. So since it is a common causes that is causing this transudate type of pleural effusion, so it will be bilateral on both sides of the pleural cavity. So now coming to our topic, which is main, that how we can differentiate the two types of pleural effusion. So for that I have made a very easy mnemonic: appear, cell, LPG. This appear, cell, LPG. Now this is the mnemonic how you can memorize all the points of differentiation between the two pleural effusions. Then one other main point is that in exudate all the things are increased except two major things, that is pH and glucose. Otherwise all are increased in exudate. Fine. Then how to memorize them? Now suppose this is according to this mnemonic is that first is appearance. Fine. So appearance is that in transudate it will be clear, in exudate it will be cloudy and purulent. Now why cloudy and purulent? Because we know some proteins are lost in the fluid and many other substances, so it will make it cloudy or purulent, pus containing. Then C, from this cell you can memorize that how much cells are present in it, what is the number of cells, and what is the type of cell present. Now number is, we know that transudate will be less, exudate will be more, so less than 1000, and in it greater than 50,000 in exudate. Moving on to the type. Now the type is lymphocytes and monocytes in transudate and neutrophils in the exudate. Moving on, now by remembering this LPG. Now L is LDH, again the same thing, what will be the value of LDH and what will be the ratio. Now ratio is that amount of LDH in pleural fluid to that in serum ratio. So you can remember this value will be, of course, of LDH is less than 200, and we know that values are increased in case of exudate, so it will be more than 2/3 of the upper limit of normal. Fine. Moving on to this ratio. Now there are two ratios in it. One is of LDH and the other is of protein ratio. Now, so in proteins, just remember it by a mnemonic, that is P. In Urdu, we can make panch, that is 5, by this word P. So you can memorize that 0.5 is the value here of this ratio, and then 0.5 we know that less is in transudate, more is in exudate, so less than 0.5, more than 0.5. Moving on, this pleural fluid to serum LDH ratio, that is 6. We can remember L6 is a mnemonic, so L6, say 0.6 will be less than 0.6 transudate, more than 0.6 exudate. Now from L we have done, then the mnemonic P. P we can make first is proteins, and we know that proteins are more in exudate, less in transudate. Then second P will be the ratio of pleural fluid to serum protein ratio, and third is pH. Now we know that pH and glucose are the two major parameters that are less in exudate, otherwise all are increased in exudate. So pH will be less in exudate, more normal in transudate. And by this G, now G you can remember glucose, you can remember gram stain and gravity of the fluid. Glucose is, of course, I've told you that it will be less in exudate, normal in transudate, gram stain. Now since in exudate we know that bacteria are taking part, so gram stain positive will be present in exudate. And gravity, now I told that everything is high in exudate except those two parameters. So gravity will be high in exudate and less in transudate. Now this is by how you can memorize these differences according to the mnemonic: appear, cell, LPG. Appearance, cell type, cell number. L will be lactate dehydrogenase, its value and its ratio. P, protein, its value, its ratio, and the pH. G, gram stain, glucose, and gravity. Fine. Now overall, if you just even forget the mnemonic too, and then how you can memorize it, that take a fluid. Fine. First you will see that okay, what is the appearance of that fluid, then what does it contains. It contains cells, protein, glucose, LDH, and then the ratio when we'll compare that fluid with our blood serum. So this is an easy way. Then what will be the gravity of that fluid? By this way you can even recall the differences very easily. And just remember, everything is increased in exudate, normal or decreased in transudate, except two major points: glucose and pH, that is less in exudate. Fine. I hope you like the mnemonic. I hope this video, after listening it, make it easy for you to memorize the difference between transudate and exudate pleural effusion. If you liked it, please give it a thumbs up, share it with your fellows, subscribe my channel. Thank you so much. Allah Hafiz.